So hello friends, I am Dr. Vikas Agarwal. I am the head department of urology, robotics, uro-oncology and kidney transplant at Aakash Healthcare Dwarka. So as we all know that robotic and kidney transplant is the treatment of choice for kidney failure patient. Though dialysis is again an option, but if you can opt for kidney transplant, you have relative your who is willing to donate you kidney. So that is the one of the best treatment, and it really changes your life. So recently we have done a transplant for a patient who has come from Gambia, and she was Mama Kaise, and she was suffering from end-stage renal disease. She was on dialysis, and after detailed workup, we took her for the kidney transplant, and her brother gave the kidney as a kidney donor. I would like that she share her experience of kidney transplant, which has been done at Aakash Healthcare, so that many people or many can understand the problem and they can really get motivated.
My name is Mama. I came from Gambia. I have kidney failure. I did kidney transplant. My embassy told me that there is a particular hospital in India called Aakash. So I need to go there and did my transplant. I was having a little bit of pain, but after the transplants, I am feeling okay now. Dr. Vikram Karla, Dr. Vikas, and Dr. Anupam. They helped me during the transplant. They make my transplant work.
Hello friends, I am Dr. Anupam Roy, Additional Director in the Department of Nephrology and Kidney Transplant at Aakash Healthcare, India, Delhi. So today I am going to talk about a very challenging patient that we treated in the last couple of months. So she was a young girl, 27 years old, who had hypertension and who was on dialysis. She came to us for a kidney transplant. When we took her history, there was a history of bilateral nephrectomy, that is, both the kidneys were removed for some disease. The details exactly were not known. But for us, she was a huge challenge. She had very high blood pressures, she was in gross fluid overload, and therefore she required admission in the ICU, and initial stabilization required a lot of care. All her medications had to be optimized. She had to be on intensive dialysis to optimize her status. After the workup, we realized that she is a very high risk case for transplant because she had history of multiple blood transfusions, she had uncontrolled blood pressures, and the fact that she had no urine output because of the bilateral nephrectomy, and she had multiple cardiac problems as well.
Yeah, after transplant, I'm feeling okay now. My body is getting better. Yeah, because the transplant was successful. Doctor and staff, they were very good to me. They were polite to me too.
And everything went well, but to our surprise, there was a problem into the vein of the patient, and in which we have to join the new kidney. So on the opening, there was no lumen into it. So we have to go little higher on the big vessels to make the anastomosis. But everything went very well. Patient tolerated surgery very well. And I think this kidney transplant will really help her to change her quality of life. And definitely, if you have a relative donor, so kidney transplant can change your life, or it gives you second life.
So after intensive investigations and aggressive management of her clinical condition, she was optimized and was taken up for a kidney transplant. Subsequently, she underwent a live-related kidney transplant wherein her brother donated the kidney, and she had a successful recovery after the kidney transplantation.
If I see anyone battling with kidney failure, I will recommend Aakash Hospital for the various passive, because Aakash Hospital is a very good hospital.
Now she is living a normal, absolutely normal life with good blood pressure control and on minimum medications, not on dialysis, and now she is fit to travel back to her country. We wish her all the best. Thank you.